What does a pathologist do with your biopsy? When you have a biopsy to check for conditions like non-Hodgkin lymphoma, your tissue sample goes on a detailed journey to help your doctor understand what's happening inside your body. After the biopsy, the tissue is sent to a specialized laboratory where a pathologist, a doctor trained to study tissues and cells, takes over. Their job is to carefully examine your sample to find out if disease is present and what type it might be. First, the pathologist performs a gross examination. They look at the tissue with their eyes to assess its size, shape, color, and texture. This initial step helps identify the most interesting areas of the sample for closer study. For larger tissue pieces, this process can take a few days, as they need to be thorough and precise. Next, the tissue is processed. It is embedded in a special substance, sliced into very thin sections, and stained with dyes that make cellular structures stand out under a microscope. This step is crucial because it reveals the tiny details of the cells and tissues. The pathologist then examines these stained slides under a microscope, searching for abnormal cells, signs of cancer, or specific features that indicate lymphoma. They look at how the cells are arranged, their size and shape, and whether they invade nearby tissues. If lymphoma is suspected, the pathologist might perform additional tests. These include immunohistochemistry, which uses special antibodies to detect specific proteins on the cells, helping to identify the exact type of lymphoma. They may also use flow cytometry to analyze cell markers or molecular tests to look for genetic changes. These extra steps help classify the lymphoma more precisely, which is vital for choosing the best treatment. Once all the analysis is complete, the pathologist writes a detailed report. This report describes what they saw in the tissue, including the cellular details and whether cancer or lymphoma is present. It also states the specific subtype and grade of lymphoma if diagnosed, and notes the margins or extent of the disease if relevant. This report is then sent to your doctor, who uses it to plan your treatment and next steps. In essence, the pathologist acts as a detective, transforming a tiny tissue sample into vital information. They examine it at multiple levels, from the overall appearance to microscopic and molecular details, ensuring an accurate diagnosis. This process is essential because it guides your healthcare team in making informed decisions about your care. Always remember to discuss your results with your healthcare provider, who can interpret the findings in the context of your overall health and symptoms.